Hi everyone, we're going to continue our series called Ask a PT. For this one, we're going to talk about knee pain. In particular, 3 causes of knee pain. We're going to break it down into 3 parts. So for this video, this is part 1. We're going to talk about osteoarthritis and what that is and how it causes knee pain. Most all of us will have some degree of osteoarthritis in our joints. And because our joints will wear down with time, we live under gravity. Gravity's pushing down on us. Our joints take a lot of pressure and wear and tear occurs. So what happens is the cartilage that lines the bone wears down over time and the meniscus wears down over time. So essentially you're rubbing 2 bony surfaces on each other. And so that can be quite painful to some, and again, some don't have much pain at all. And one of the classic signs of severe osteoarthritis in the knee is that you have what's called a flexion contracture, meaning the knee cannot straighten all the way. So your knee is somewhat bent. And then also what happens is over time, as the bone wears on each other, the bone actually grows. So you actually have a thickening of the bone around it. So the knee looks swollen always, but it's actually hypertrophy or enlarging of the bone surface. What we do in physical therapy is we want to preserve function that we have. So number one, if you have a flexion contracture, we try to get it extended as best we can. So we want to preserve extension. And the other one is we want to protect the joint as much as possible by strengthening the muscles around the joint. So we do a lot of quad strengthening. So some of the treatments that you can do on your own if you start to have what's called a flexion contracture of the knee. The first one you can do is just mobilize the kneecap. Okay. So Teresa, I want you to take your hand on your kneecap and just take the palm of the hand and just put it right on top. I just want you to just mobilize the kneecap down and back. Just mobilize it down and back. And we're just going to essentially move the patella back and forth. Just do it in a comfortable range so that you want the kneecap moving and mobilizing. Okay, and that's a simple one you can do at home. The second one you can do is get a towel and roll it up, or use something like this, like a cushion, and work on extending your knee straight, Teresa. Okay, and flex your foot up for me. And try to straighten your knee as strong as you can. So make a strong contraction of the thigh and then come back down. So you don't need a huge bolster or a huge roll, but something that makes you or forces you to extend at the very end of knee extension. So go ahead and do it again and try to get that quad to fire as best you can. Okay. So like I said, so we want to preserve or try to regain extension. Okay, so we don't want you to walk on a bent knee. It's just going to wear it down more and more. So I just wanted to share with you 2 cases who have severe osteoarthritis of the knee. Both of them have bone-on-bone presentation on x-ray, so both of them have some degree of pain, and both also have a little bit of a flexion contracture. However, one patient is, their goal is just to stay active. They want to be able to go walk to the grocery store, do their own shopping, walk to the store and back to their car, get up and down stairs. And that's a great goal to have. We're going to work with him on that. And so he is a candidate for a surgery, total knee replacement, but he elects not to do it because his goals are just to keep the knees that he has and keep them as best he can and just stay active and stay independent with daily activities. The other patient, their goal is a little bit different. They want to play golf. They want to be a little bit more athletic with it. They want to be able to run and jog. And so they're electing to do the surgery and get a knee replacement. The reason I want to contrast these 2 cases is just because you have osteoarthritis and it's really severe, meaning bone on bone, and you have a flexion contracture, it does not necessarily mean that you need to go get them replaced. It's really up to you of how you want to go forward and what kind of goals do you have. Just because of the osteoarthritis does not definitely mean that you are surgery bound. I hope that helps by talking about these 2 cases. All right, so thank you very much, and we'll see you guys next time.